Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a general practitioner talking to a patient named Mr. Edwin. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. Edwin. I understand you've been experiencing some concerns related to your recent diabetes diagnosis. Before we dive in, how are you feeling about everything?
It's all a bit overwhelming, to be honest. I didn't expect this diagnosis, and now I'm just trying to understand what it really means for me, day to day.
That's completely understandable. Diabetes, especially type 2, often requires a shift in lifestyle and daily habits. But with the right approach, it's very manageable. Let's go over any specific symptoms or difficulties you've been experiencing. Can you tell me more about your current routine?
Sure. I work long hours at a desk job, so I don't get much physical activity. My diet probably hasn't helped much either. Quick meals, snacks, lots of coffee. I've also been feeling more tired than usual and noticed I get pretty thirsty at random times.
That tiredness and increased thirst are quite common with diabetes. When blood sugar levels stay high, it often leads to increased urination, which can dehydrate you and make you feel more fatigued. Do you check your blood sugar regularly?
Not yet. I haven't started monitoring it on my own. I guess I'm not really sure how, and honestly, the whole thing feels a bit daunting.
Understandable. Learning to manage diabetes can feel like a big change, but we'll take it one step at a time. I'll walk you through using a blood glucose meter, which will help you keep track of your levels. Knowing your numbers is a valuable tool for managing the condition.
I see. I'm also worried about long-term complications. I've read that diabetes can lead to serious health issues.
Yes, untreated or poorly managed diabetes can lead to complications such as nerve damage, cardiovascular disease, and vision problems. However, with good blood sugar control, you can significantly reduce your risk. Let's discuss how lifestyle changes can help with that. First, tell me a bit more about your physical activity.
Honestly, I'm not very active. I used to walk regularly, but that hasn't happened much in the past year or so.
Exercise is a great way to help manage diabetes because it helps your body use insulin more effectively, which can lower blood sugar levels. Starting with something simple, like a daily 20 to 30-minute walk, can make a big difference. Do you think that's something you could work into your routine?
I think so. I can probably start with short walks after work or during my lunch break.
That sounds like a great start. As you feel more comfortable, you can gradually increase your activity. Small, consistent changes can lead to big improvements over time. Now, regarding your diet, are there any areas you're especially concerned about?
I know I eat too much processed food, quick meals and snacks, like I said. I don't really plan meals, which probably isn't the best approach.
Meal planning can help you make better choices, especially with diabetes. Try aiming for balanced meals with whole grains, lean proteins, healthy fats, and plenty of vegetables. Reducing sugary foods and refined carbs will also help stabilize your blood sugar. I can provide some resources to help with meal planning if that would be useful.
That would be great. I think part of it is just needing to know where to start.
Absolutely. Starting can be the hardest part, but with a few adjustments, you'll find a routine that works for you. Now, do you have any questions about medication? I noticed you're not on any medication yet, is that correct?
Yes, I haven't started any. Is medication necessary, or can I manage this through lifestyle changes?
In some cases, type 2 diabetes can be managed through lifestyle alone, especially if you catch it early. However, if blood sugar levels are high, medication can be very helpful in controlling them. We'll monitor your progress, and if lifestyle changes alone aren't enough, we can discuss options like metformin, which helps lower blood sugar levels.
I see. That makes sense. So, I'd have regular checkups to track how things are going?
Yes, exactly. Regular checkups allow us to see how well your lifestyle changes are working and make adjustments as needed. I recommend coming in every 3 months for now to review your blood sugar levels and overall health.
That sounds good to me. I just want to make sure I'm doing everything I can.
I can see that, and it's great to see you taking such an active role. In addition to exercise and dietary changes, prioritizing sleep and managing stress can also help you control blood sugar. High stress levels can increase blood sugar, so finding ways to relax, whether through hobbies or mindfulness exercises, is important.
I hadn't thought about stress affecting my blood sugar, but that makes sense. I'll try to work on that too.
Extract 2, questions 13 to 24. You hear a specialist discussing alcohol poisoning with a patient named Mr. Russell. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Mr. Russell. Please have a seat. I understand you're here to discuss the incident from last month and how we can manage any lingering effects. I've reviewed your file and noted that your GP referred you after you were treated for alcohol poisoning. Would you be comfortable sharing what happened?
Yes, I'd like to understand what went wrong. I was out with some friends, and we were just having a good time. I didn't realize I'd overdone it until it was too late. I barely remember the night, but I was told I lost consciousness and was taken to the hospital.
That must have been frightening. Let's go over a few details to help us understand the situation and set up a plan for moving forward. Do you recall roughly how much you'd had to drink?
I think I had a few cocktails early on, and then we moved to stronger drinks. My friend said I was having shots, but I don't remember much after that point.
It sounds like there was a combination of different drinks and potentially higher alcohol content as the night progressed. Alcohol poisoning can happen when large amounts of alcohol are consumed in a short period, overwhelming your system. When blood alcohol levels rise too quickly, critical functions like breathing, heart rate, and reflexes can be dangerously impacted, even to the point of losing consciousness as you experienced.
Yes, I understand. But why did it get so bad? I've been out drinking before and nothing like this happened.
It's a common question. Factors like how much food you've eaten, your body weight, and how quickly you're consuming alcohol can all influence how alcohol affects you. In addition, tolerance builds over time. So sometimes individuals find they need to drink more to feel the same effects. But this can increase the risk of accidental poisoning without necessarily feeling more intoxicated right away.
That makes sense. I had skipped dinner that night, so I suppose that didn't help.
Exactly. Food helps slow alcohol absorption. Drinking on an empty stomach means alcohol enters your bloodstream more rapidly. That, combined with quick consumption, can lead to a steep rise in blood alcohol concentration. High levels can depress the nervous system, which is why you felt so unwell and blacked out.
I didn't realize it could affect my body that way. What about the long-term effects? My GP mentioned liver damage could be a concern, and I felt very low energy since it happened.
Alcohol poisoning can indeed strain your liver because it's responsible for processing and filtering toxins. While a single incident isn't likely to cause permanent liver damage, frequent binge drinking episodes can increase your risk of long-term issues, like fatty liver disease, hepatitis, or even cirrhosis over time. The fatigue you're experiencing now is part of your body's recovery from the incident. It's working overtime to process and heal. How are you feeling generally since the episode?
It's been a bit rough, honestly. I've noticed headaches, difficulty concentrating, and sometimes I feel nauseous even if I haven't had anything to drink.
That's fairly typical after an alcohol poisoning episode. The physical symptoms, fatigue, nausea, and headaches, are your body's way of recovering. Mental fog and concentration issues are also common, as alcohol can disrupt cognitive functions. If these symptoms continue, we may explore blood tests to check your liver function and assess if any other areas need attention.
I'd appreciate that. I want to avoid this happening again, but I also want to make sure I'm not doing long-term damage.
I completely understand. Part of preventing another incident is increasing awareness around what and how much you're drinking. We have some strategies to help you gauge your alcohol intake more safely. First, if you're drinking, try to alternate alcoholic beverages with water and avoid drinking on an empty stomach. It's also helpful to know standard drink measurements, so you're aware of how much alcohol you're actually consuming.
That sounds manageable. I guess pacing myself will be key. But is there anything specific I can do if I notice someone else is drinking too much?
Good question. If you're with someone showing signs of alcohol poisoning, such as vomiting, slow or irregular breathing, confusion or unconsciousness, it's crucial to act quickly. Stay with them and call emergency services. Turning them onto their side can help prevent choking if they vomit. Avoid giving them food, coffee, or trying to wake them up with a cold shower. These don't speed up alcohol processing and can even be dangerous.
I had no idea there were so many misconceptions about it. I always thought a cold shower would help sober someone up.
That's a common belief, but unfortunately it's not true. Only time can lower blood alcohol levels. While it's natural to want to do something immediately, the safest course is to get medical help if someone is unresponsive or seems seriously affected.
I'll definitely remember that. And what about aftercare? Are there ways I can help my body recover?
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a doctor briefing a colleague about an unusual case. Now read the question.
Mrs. Grant came in yesterday complaining of lower abdominal pain. She mentioned she'd had an intrauterine device for years without any problems. After examining her, I realized her symptoms were quite unusual for a typical IUD issue. A scan of her pelvis showed that her IUD had eroded through the uterus and punctured her bladder. Once I saw the scan results, it became clear why she was in pain. I immediately referred her for a surgical consultation to have it removed.
Now look at question 26. You hear a nurse explaining to a patient. Now read the question.
Participate in your care to improve safety during your stay.
Oh, that sounds helpful. What exactly does it cover?
It covers 5 main areas to help you stay safe, such as understanding your medications, preventing falls, ensuring clear communication with the medical team, and a few others. I'm giving you this informational guide that explains each area. We also encourage you to share this with your family members who may be here during your stay, so they can be involved as well.
Thank you. This will give me something to look through while I'm here.
You're very welcome. I'll check back in later if you have any questions.
Now look at question 27. You hear a training on recognizing and managing burnout among healthcare professionals. Now read the question.
Hello everyone, and welcome to this training on recognizing and managing burnout among healthcare professionals. First, let's take a look at the main objectives of this course. By the end of the course, you will be able to identify the key signs of burnout and understand which situations may contribute to stress and exhaustion among staff. We will also discuss how to implement self-care strategies and develop a supportive work environment that prioritizes the mental health and well-being of healthcare professionals. Next, we will work with case studies so that you will learn how to create personalized action plans to mitigate burnout and demonstrate effective methods for communicating with team members about mental health. Additionally, we will explore the steps for distinguishing individual challenges from systemic issues in the workplace. Our final set of objectives relates to fostering a culture of openness and ongoing support across all levels of the organization.
Now look at question 28. You hear a healthcare expert discussing the principles behind precision medicine to medical trainees. Now, read the question.
Precision medicine is an approach where medical treatment is tailored specifically to an individual's unique characteristics, such as genetic profile, lifestyle, and environment. This concept allows for highly targeted therapies that can significantly improve treatment outcomes. For instance, pharmacogenomics, a field that studies how a person's genes affect their response to drugs, enables healthcare providers to select the most effective medications and dosages for patients. Similarly, advancements in genomics allow for the identification of genetic mutations linked to diseases, leading to treatments that are more personalized and effective. Another critical element is targeted therapies, which focus on specific molecules involved in disease progression, such as cancer cells, while minimizing damage to healthy tissues. Understanding these principles helps medical professionals make informed decisions and provide better patient care. Recognizing the elements of precision medicine will allow trainees to more effectively adopt these practices and contribute to making personalized treatment more accessible to patients.
Now look at question 29. You hear a hospital nurse briefing a colleague about a patient with chronic obstructive pulmonary disease, or COPD. Now read the question. So, who's next?
The patient in bed 10. He has COPD with significant airway inflammation, which we've been monitoring closely. He's managing independently at home, but has had some recent respiratory flare-ups.
Okay.
His inflammation levels are higher than usual due to seasonal allergies. They've been experimenting with adjustments to his inhaler regimen and assessing his response to the anti-inflammatory medications.
That's good.
He's on a controlled diet to manage potential triggers, but his inflammation has made breathing difficult, especially in the mornings.
Oh, I see.
Observations were last done at 7 a.m., and he's stable for now. He's due for his next dose of budesonide at 4 p.m., with a check-in on his inhaler technique from the respiratory therapist.
Okay.
The doctors want you to check in later to confirm if his inflammation levels have dropped, and whether they should continue adjusting his inhaler settings or explore additional anti-inflammatory options. They're hoping for better control within a few days.
Okay, thanks. Now look at question 30. You hear part of a morning briefing in a healthcare clinic. Now read the question.
We're focusing on language support for non-English speaking patients. Can we go over our current cases where language barriers are a concern? Juan, could you start, please?
Certainly. We have Mr. Diaz, who came in yesterday with respiratory distress. He speaks limited English and prefers to communicate in Spanish. During his initial assessment, he indicated pain in his chest and shortness of breath, but we couldn't gather all details clearly due to the language barrier. His vital signs on admission were temperature 38.2 degrees Celsius, blood pressure 101,075, pulse 92, and respiratory rate of 2004. A translator is expected later this afternoon.
Thank you. Until the translator arrives, let's ensure we're using our Spanish language guides and translation apps as needed to maintain basic communication and provide comfort. His symptoms will be monitored closely, and we'll focus on supportive care until we have more information. Moving on.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear an interview with Dr. Sylvia Park, an expert in digital health initiatives and patient engagement. You now have 90 seconds to read questions.
Digital health literacy is emerging as a crucial factor in empowering patients to engage more actively in their own healthcare. I'm Jandine, and my guest today is Dr. Sylvia Park, an expert in digital health initiatives and patient engagement. Dr. Park, thank you for joining us.
Thank you, Jan. I'm really excited to discuss this topic. Digital health literacy has become a central part of how patients manage their health, and it's something healthcare providers are increasingly supporting.
So, why do you believe digital health literacy is essential for patient empowerment and engagement in healthcare?
Digital health literacy equips patients with the skills to access, interpret, and use online health information and tools effectively. When patients are digitally literate, they can navigate telemedicine, manage electronic health records, and even use mobile health apps. These skills allow patients to make more informed decisions, giving them a greater sense of control over their health, which is fundamental to patient empowerment.
That makes a lot of sense. And how do healthcare providers fit into this? Do they play a role in educating patients on these digital health tools?
Absolutely. Providers have a key role in educating patients. While digital tools are available, many patients need guidance on how to use them safely and effectively. Providers can introduce patients to specific apps, show them how to interpret online health information, and even help them set up telehealth appointments. With this support, patients become more comfortable with digital tools and can use them to their full advantage in managing their care.
I see. But I imagine not everyone has the same level of access or ability to use these digital resources. What kind of barriers do patients face?
That's correct. There are several barriers, and they vary across different populations. For some, a lack of internet access is a major issue, especially in rural or low-income areas. Others may not have the necessary devices, such as smartphones or computers. Additionally, there's the matter of technical skill. Some individuals, particularly older adults, may not feel comfortable using technology. Language barriers can also hinder access, especially for non-native speakers who may struggle with English-based digital resources.
It sounds like there are multiple layers to address. Do you see any particular strategies being effective in overcoming these barriers?
Yes, there are a few promising approaches. Some healthcare systems are working on providing digital literacy training for patients. They might offer workshops or one-on-one support to help patients learn how to use these tools. Additionally, some initiatives are focused on making devices and internet access more affordable and available to underserved communities. By creating a more accessible infrastructure and offering tailored support, these programs can help bridge the digital divide.
That's encouraging to hear. Finally, what can patients do on their own to improve their digital health literacy?
Patients can start by exploring online resources from reputable organizations like the CDC or Mayo Clinic to familiarize themselves with the kind of health information that's available. They might also consider trying out a telemedicine visit with their provider, which can be a great way to practice using digital tools in a supported environment. The key is to start small and build confidence gradually. Even small steps in digital health literacy can make a significant difference in their health engagement over time.
Extract 2. Questions 37 to 42. You hear a conversation with Dr. Samuel Reed from the Department of Public Health at New York University. Now, read the questions. You now have 90 seconds to read questions.
Welcome to today's discussion. My guest is Dr. Samuel Reed from the Department of Public Health at New York University. Dr. Reed is here to discuss some findings from his recent studies on the impact of urbanization on public health. Dr. Reed, thank you for joining us today. What would you say is the most significant takeaway from your research?
Thanks for having me. One of the main takeaways is that urbanization, particularly in densely populated cities, has significant effects on both physical and mental health. While urbanization can provide better access to healthcare services and job opportunities, it also brings challenges like air pollution, reduced green spaces, and increased social isolation. These challenges can have a long-lasting impact on residents' well-being if not properly addressed.
Let's start with air pollution. How does urban air quality affect public health?
Air pollution is one of the biggest challenges for urban public health.
Pollutants from vehicle emissions, industrial facilities, and construction sites contribute to a wide range of respiratory issues, including asthma, chronic bronchitis, and other lung diseases. Long-term exposure has also been linked to cardiovascular diseases and even premature death. Research shows that populations in urban areas with high pollution levels tend to have higher rates of these conditions. Cities need stricter air quality regulations and more green spaces, which can act as natural air purifiers to mitigate these effects.
What role do green spaces play in improving urban health?
Green spaces, like parks and gardens, are essential for both physical and mental well-being. Physically, they encourage exercise, which reduces the risk of obesity, diabetes, and other chronic illnesses. Mentally, they offer a place for relaxation, social interaction, and stress reduction. Studies have shown that people who live near parks tend to have lower rates of depression and anxiety, but many urban areas have limited green spaces, often because of a focus on housing and commercial developments. To improve health, cities need to incorporate more accessible green spaces into their planning.
That makes sense. How does urban living contribute to social isolation?
Social isolation is a growing problem in many urban areas, especially among older adults. With the fast-paced lifestyle, heavy traffic, and limited community engagement, people often find it difficult to connect with neighbors. High-rise buildings can also limit social interaction, as people rarely engage with others outside their own apartments. Social isolation has been shown to negatively impact mental health, increasing the risk of depression and even cognitive decline. To combat this, urban planners need to create spaces that encourage socialization, like community centers and pedestrian-friendly areas.
What strategies have you seen work in other cities to counter these challenges?
Some cities have taken innovative steps. For example, Singapore has integrated green roofs and walls throughout its cityscape, improving air quality and providing more green areas for people to enjoy. Copenhagen has created numerous pedestrian-friendly zones that encourage social interaction and exercise. In New York City, there's been a push to create more public spaces for social gathering. These changes aren't just about aesthetics, they're about creating healthier, more livable environments that support well-being.
What do you think is the biggest barrier to creating these healthier urban environments?
One major barrier is the cost of implementing these changes. Green spaces, pedestrian zones, and pollution control measures require significant investment. Additionally, there's often a lack of cooperation between city planners, health officials, and policymakers. Many cities are more focused on economic growth, sometimes overlooking public health priorities. However, studies show that investing in health-focused urban development leads to long-term savings in healthcare costs and improves residents' quality of life.
What are some of the concerns from residents about these urban health initiatives?
One concern is that initiatives like creating green spaces or improving air quality might lead to gentrification, where the cost of living rises, pushing out lower-income residents. This issue is often called green gentrification. Residents worry that as neighborhoods become healthier and more desirable, they may no longer be affordable to the original community members. Cities need to carefully balance urban health initiatives with affordable housing policies to ensure equitable access to these benefits.
Dr. Reed, thank you for sharing these insights. It's clear that addressing public health in urban areas requires a holistic approach.
Thank you. It's an important issue, and I hope these discussions encourage more cities to consider health impacts in their planning decisions.
That is the end of Part C. You now have 2 minutes to check your answers.